Hey guys, this is your West Coast Buckeye here, Deidra Kathleen. I'm here with my good friend Lucinda Bruce. Lucinda, where you at?
I am in Victoria, Australia, about an hour and a half out of Melbourne, which is the
Okay.
capital of Victoria. Yeah.
Okay. What did you say the capital is?
So it's like the state capital, which is Melbourne. The
Mm-hmm.
capital of Australia is is Canberra, in the ACT, which is where all political and the politicians live at.
Okay, what does ACT stand for exactly?
The Australian Capital Territory. So it's one of the territories of Australia, and there is the Northern Territory, the ACT, and there's a couple of other smaller territories, and the rest of the country is made up of states.
You have the ACT, and you said that there are territories. How many are there?
So there's the Australian Capital Territory, there's the Northern Territory, and then there's a couple of other smaller territories which I can't quite think of the names of at the moment, and then there are the states, and there's about 6 states, I think. So there's Western Australia, South Australia, Victoria, where I am, New South Wales, Queensland, and Tasmania.
Mm-hmm.
And yeah, I think that's right. I'll probably get torn apart if I've got that wrong, but that's okay.
Okay, and y'all just had an election.
Yeah.
What's the vibe like about that? Are you happy about it, or like as a country? It doesn't have to be.
As a country, yes, I think there's a lot of people that are happy about it. I very rarely kind of get involved in politics to the point where it can be such a volatile conversation with some people, but generally I've found that the people that I sort of do and tend to spend a bit of time with are very happy about the outcome. I think the 2 main parties that were running this year, it was a bit of a landslide victory for the one that won. And there were quite a few reasons as to why that happened. And the general consensus is, I think we voted like 86 to, whatever was because it's divided up between a whole bunch of parties. There's like, I think 12 or 13 parties that run for the election, but there are only 2 major parties that tend to get in every time, which is Labor or Liberal. And Labor won this year. With Anthony Albanese, who has now become our Prime Minister, and that's the head of our country, so to speak.
Okay. So in regards to voting, so you mentioned up to like 13 parties, and I'm interested in the voting process, but I would also like to know, do you have live debates on TV prior to voting?
Yeah, they do. They do live discussions around their policies and what they're hoping to achieve, and very similar in a lot of ways to, I guess, any real sort of political decision. They contest their policies, what their party will do for the country. We've had Labor in, I think, now the last 2 or 3 times in a row. Mm-hmm. And they've done a lot of different things and managed the pandemic and all sorts of different things. And as far as I'm aware, I don't keep across it very much because it's such a dividing topic at the moment, unfortunately. And I don't like being divided from people. I think we do more when we're together on something and when we can have discussions about things without being upset about it, and have very intelligent discussions on things. And I find that politics, unfortunately, seems to divide people so drastically that it's gotten to a point, not so much here in Australia, but in other places in the world where you can't even have a conversation around politics because people are so either frustrated, so they get angry, or they spout off things that aren't necessarily true, or they question your things that you're talking about as being false or whatnot. So, those conversations and debates leading up to the election process, I think, are extremely important because they should be about what are you doing for the country, not about bashing the other opponent, not about putting down their party, but just talking about what you're going to do for the country and focusing on the positive outcomes of those policies.
Yeah, that would be wonderful. I have. Yeah. Yeah. Well, here obviously politics are divvied up into 2 because there is no hearing the opposing side. In regards to these live TV debates or discussions, however you want to classify them, are they fact-checked live?
To be honest, I don't really know. We're not at a point, I don't think, where we question things as much as, and not in a bad way, I think in a good way, in that we trust what people are saying to us. We trust what the media are telling us. We trust what politicians are telling us to a certain extent. I mean, everybody jokes about never trusting a politician, and that's fine, and it's a funny joke to make. But I think at the end of the day, we do trust in the system probably a lot more than maybe other people do in other parts of the world. But that's, they may have very good reasons not to. And there are definitely people here that don't necessarily trust what they're being told. But the fact-checking element, I think comes into play more, again, when one opponent is trying to contest the other opponent. Whereas I feel like when they're simply talking about their policies and what they're aimed to do, it's not something that can necessarily be fact-checked unless they're saying, well, look what I did already. That can be fact-checked. But look what I'm going to do can't be necessarily. And I think when we're focusing on the future and what the policies that certain politicians want to bring in to help run the country in a good direction, they're not really necessarily something that you can fact-check. But if they're sitting there going, well, you, to their opponent, never did this, that's definitely something that should be fact-checked. But because they don't really necessarily do that. I mean, I didn't watch these last couple ones for this election because I already knew who I wanted to vote for. It was so I don't know very much about how much they're kind of trying to undermine each other, but I know they do a little bit of it, but, in the Aussie culture, it's a little bit more acceptable to rib each other a little bit, but it's not okay to be downright sort of offensive, like you've got to keep it to a certain standard, and as far as I'm aware. But again, my experience is probably a little bit more limited than other people's, and, while I don't make politics an everyday part of my life, I know that it does play an everyday part in my life and the choices I get to make as an individual.
Okay. Do you feel like as a country that you are improving? And if so, how?
I think as a country, generally, I don't feel like it's going in any negative direction. I know that there are always challenges to overcome, and I think some of the challenges across the world are fairly similar with different countries. I think Australia is a great place to grow up. I think it's one of the best places in the world to grow up. We often refer to it as the lucky country. We're very lucky to have such a stable environment, not only politically, but geographically and, everything else that comes with being situated where we are as a continent. I think generally life here can be challenging, but I'm very lucky I feel like potentially that because I've traveled a lot and I've seen other countries and I've lived in other places in the world, I feel that my perspective is very much refined to recognize when I've got it good and when I don't. And my experiences of living in other countries has taught me that we have an amazing country here. It's not perfect. No country is. It needs work. It constantly needs to be kind of moving forward. I don't think it's going negatively or moving in a backwards direction. I think potentially if the person who didn't win had won, that is a possibility. But again, I don't know for sure because who knows, right? We've got to see the outcome before you can really judge somebody on something. Not that that's what we do as human beings, but generally speaking, you should always give somebody the opportunity to do the right thing by your country before you make a judgment call on them. But generally, I think it's one of the best places to live in the world, and I wouldn't want to live anywhere else. I love visiting other countries. I love spending time in other countries. Other countries in the world are beautiful, and there are arguably better countries in the world to live than Australia. But with all the places that I've been and some of the places I've ended up staying for any length of time in, I love it here and I wouldn't change it for the world.
So in Australia, you have different territories, and here in the US, we have our states. And our states are so incredibly different. I was wondering how you would differentiate your territory compared to the others. Is there an incredible difference, or what do you think?
No, look, there are key differences between the states. So I live in Victoria, which is considered a state, but I can travel freely just like you can in America and Canada and, different places that are similar in setup. I can travel freely anywhere I want to. If I was to say move states, there'd be things I'd have to do, like, change my license and follow all the rules and stuff. And there are slightly different laws for, say, driving on the road, slightly different things that some states do as opposed to others. the cops in different states and territories wear different uniforms, but they're all very clear about, that they look like cops, so you can easily identify them. So the cop cars look slightly different from state to state, and different in the territories as well, but still similar enough that you kind of go, yep, that's a cop car. There's no wildly different things.
What do they look
So,
like? You have to tell us what they look like.
Here in Victoria, they wear a blue uniform, and I think in New South Wales it's blue as well. The markings on the cop car are a little bit different in New South Wales to Victoria, and I think there are a few other key differences. You go somewhere like the Northern Territory, and depending on where you are in the Northern Territory, I think some of their uniforms are brown from memory, but generally it's blue, and the blue and red is synonymous with the police force here. So it doesn't kind of matter where you go, you'll always get pulled over by a red and blue light. It's not like they changed that drastically. And the markings are usually fairly similar.
Which side of the road Which side of the road do you drive on?
We drive on the left, which is always fun when I travel, because when I travel to America, it's a very different experience. But I'm quite lucky. I find it quite naturally easy to translate between the two things. In fact, driving in America is a lot of fun. I love driving over there.
What's interesting to me is that both South Korea and Moldova, they both drive on the same side as us.
Yeah. Look, even when you go to somewhere like England and then you want to drive into Europe, you've got to change which side of the road you drive on. So England is left side of the road, so it's the same as here. And then you go to Europe and they're on the right side of the road, and you have to just, change your way of thinking when you cross over. And I'm very lucky. I've traveled around Europe quite a bit. I've been to quite a few of the different countries in Europe, and it's a very different experience driving in Europe than it is to England, for instance, than it is to America and Australia. And it doesn't really seem to matter what side of the road you drive on. There are very contrasting differences in road rules and regulations and things like that. But almost everywhere you go expects you to wear a seatbelt. So that's one commonality we all seem to have.
The New York Department of Health has made a list of all the countries in the world that have universal health care. And that the list goes from like the early 1900s until the late 1990s. Okay. For Australia, it lists that the implementation of universal health care started for y'all in 1975. We don't have it here. Go figure. Well, more like it. Not a shock to you because you've been here.
I've been there.
I laugh, but not a funny thing.
It's the laugh of despair. Yes.
Very much so. So in 2020, Yale did a study and found that Medicare for all would save around 68,000 lives per year, as well as $450 billion a year for the United States. Also, prior to Obamacare coming into effect, aka the Affordable Care Act, same thing, different name. According to the CDC, pre-existing conditions are common, very common. About 129 million people in the U.S. have at least one major chronic disease, such as heart disease, cancer, diabetes, obesity, or hypertension. And then it continues on in this article outside of the sourcing, saying millions more have other chronic conditions like asthma, kidney disease, respiratory ailments, depression, and other mental health conditions. So the sitch with this is prior to Obamacare, aka the Affordable Care Act, health insurance companies could just be like, yeah, you already had that, not our problem, kind of a thing. So it became like an actual, hey, this is a real thing for everybody now. Like, you have to help people even when they have pre-existing conditions. That's a major thing that Obamacare, aka the Affordable Care Act, helped out with. So it kind of started paving the way towards universal health care, or at least ensuring Americans would be taken care of more so than we have in the past, prior to the Affordable Care Act, aka Obamacare, taking action and doing as much. So I would like to know your thoughts in regards to our healthcare system compared to yours. I know you've at least been to California. Have you been to any other American state?
Yes, I have actually. I've actually visited Arizona, Nevada, New York. I've gone to Washington, D.C., Washington, Oregon. I think there's one in between Washington, D.C. and, you were talking about universal, obviously. Here we've had healthcare since, 1975, I think you said. So since before I was born. And so I've benefited from it my entire life, which has been great. No complaints from me. I love the system that we have here. I've taken full advantage of it with my spinal injury. Not intentionally, of course, because, nobody wants a spinal injury. But unfortunately, I did cop one free of charge from a job that I was doing, working at the time. And we have what's called work cover. So it's a different sort of thing to Medicare, but it still is essentially the same thing, that if you get injured at work, basically they cover your expenses, they pay for everything, they're insured for it. And it's illegal not to have it here as a company. If you're employing people, you need to have work cover insurance and you need to pay for that, so that your workers are covered if something happens. And we have similar things in the film industry where you pay insurance for general liability and safety of the people working for you and whatnot. So, but healthcare has been something amazing that I've had my whole life. You can choose. We do have two systems here. One where you can pay for private healthcare insurance, and it's a monthly fee that you pay, and some people pay, I think, $30 or $40 a month. Other people pay $30 or $40 a week, depending on the level of cover you want and whatnot. And it's basically private healthcare versus public healthcare. The biggest difference, private healthcare, because I know you mentioned talking about when healthcare came in and the act was implemented over there. Prior to that, people, if they had existing conditions, they couldn't get help. When you get private healthcare here, you have that there's a disqualifying or a period, a time frame of 12 months after you signed up to private healthcare before you can claim previous injuries or chronic, illnesses and whatnot on that private healthcare. But you can eventually do it, I believe. With the public health system, it doesn't matter. So one of the biggest differences I've noticed with sort of living in America, living in Canada, living in other places, living in England and living here, I've lived in a lot of different places. I've been very lucky to have those experiences. I mean, living, like, I've not lived in America beyond, 3 months because that's the visa kind of capacity. And I go to America to spend time with my friends and travel and network and kind of try to build my business, and create sort of, the opportunities to make films and such for myself. But when you spend 2 or 3 months in a country, you do feel like you're kind of living there a little bit, because if something goes wrong, you have to take care of that. Now, luckily for me, we have travel insurance, which is quite good. It cost me, I think the last time I bought it, about $800 or so for a year's worth of travel insurance, which was comprehensive, covered me for everything, flights being missed. If I crashed a rental car, it would cover for the whatever it's called, the excess fee. So there's a lot of things in place that really, when I travel to another country, I don't really have to worry, because I know I've got travel insurance, and it's quite comfortable. I'm quite comfortable going to anywhere in the world, because I know that my insurance will take care of me. I don't have private health insurance here, and I don't need it. The biggest difference between private healthcare here and public healthcare is the wait time. If you're in the public system, it could take 2 years for you to get surgery on something, whereas if you're with the private company, it might take 6 months or less. You'll get a private room at the hospital versus having to share it with 2 people or 3 people. But that, it just depends on the type of person you are, whether that bothers you or not. It doesn't bother me. I've been very fortunate in that, I've had surgery through the public health system, and I've had surgery through work cover after having a spinal injury at work. I've had public healthcare surgery when I had to have my gallbladder out. It cost me a whopping, I think, $96 for the medication I had to have for the whole time that I was at the hospital. That was it. And that was just because I was taking it home with me. It was medication that I had to take home. And, we have to pay for prescription medicine here, but it's very cheap in comparison to America and other places that I've been. So, I spent 5 days in hospital, 2 of those days or 3 of those days in the emergency department of 2 different hospitals, and it cost me $96. So, I might have had to wait 5 days to get surgery, but it was emergency surgery. So of course, I got bumped to the front and, taken off and had the surgery done, had my gallbladder removed, spent probably 24 hours recuperating in the hospital, and then, went home with a $96 medicine bill, and it was like 6 or 7 different medications that made up that entire amount, and a blood test that I had to pay for, which normally blood tests are free in other ways. So if you went to your GP, for instance, which usually has a pathology lab in the building. Sorry?
Your GP stands for?
General practice, so your doctor, like...
usually, okay,
yeah. Like you go to a GP, or
okay.
Here you usually have a GP that you go to, that you trust, that you like. Most of the time, GP visits are bulk billed, so you don't have to pay anything. When you do have to pay, Medicare covers a chunk of it, so you might have to pay $60 or $70 to see your doctor, but then you get $50 of it back, roughly, so you're not paying all of that money out of pocket. It's pretty amazing, really. I mean, I know that it doesn't cover everything. It doesn't. There are cases where people have to be out of pocket for elective surgery, or things that aren't necessarily an emergency, or, certain treatments that would be considered outside the purview of the Medicare system. But there's quite a lot that is covered. Dental's not covered. So getting dental stuff done, can be quite expensive, but they also have dental schools. So if you go to a dental school,
Mm-hmm.
you can get an appointment within a week, and they'll let you can get it for free because they're students and they're training and they're learning how to be dentists, so you can get dental work done for next to nothing. But that, and even though it's being done by someone who's training to learning how to do the job, they're being trained by, certified dental practitioners. Like, they're not, all noobs. So there's all these different things in place where you just kind of go, yeah, this is a pretty amazing country to live in and grow up in, because, I pay $55 a year for my ambulance cover. It costs me nothing to go in an ambulance. If I get dropped into the emergency thing for something, yes, there could be a wait time, maybe not, depends. But then the longest I think I've had to wait is maybe 5 hours in the emergency room. That was because I wasn't of the most serious cases. There were people that would come in before me, or after me even, that were more serious. So, you kind of sit there going, well, that's fair. So there's really nothing to complain about. And I think that, without sounding too callous, I think people who tend to complain more about the system and such, here probably haven't travelled to as many places or different countries to compare it with anything. So when I've spent a lot of time in the US, and I love the US, like, I love America. I love its people. It's a beautiful, weird, eclectic mix of cultures and personalities. It's amazing. It's an amazing country. But I know it would benefit greatly from having healthcare and sustainable practices in place to benefit its people, because when the people of a country are healthy and well and thriving, the economy's thriving. It's not a big conspiracy theory. It's a fact that you see it in several countries. Some people talk about healthcare being a burden on a country, but the more sort of sick people, the more you have a country full of sick people, the less you've got a working economy, the less you've got a working force that can provide, the services required for that country. So it's a balance, and I don't think that, one extreme or the other is any good. And I think Australia, being the incredible country that it is, while not perfect, definitely not by a long shot, has a lot to offer in terms of that other countries could learn from, in terms of its healthcare system and the way that, our political structure is governed.
That's amazing to hear. I know you mentioned about dental work not being covered. Is psychological work covered?
It depends. Yes, it can be. So if you go to the GP, and having had some experience with this personally, when you have trauma, spinal injury like I've had, and it's affected you for a long time, a long period in your life, and you get chronic fatigue or chronic pain, which I suffer from, unfortunately, it can have a mental toll on you. And as part of like going to your GP, you can get 2 separate things from your GP. One can be a mental health plan, and the other one can be a care plan. And the care plan, I believe, has up to 10 things that you can request throughout the year for free. And that can be physio, it could be things that normally would cost you money outside of Medicare because they're not considered emergency or general health conditions. It's like extra care. So going to a physio, going to a psychologist, seeing specialists, you know, in sort of those fields, like getting in psychology and things like that, all cost money. But you can get a healthcare plan or a mental health care plan from your GP, which provides you with a number of free visits to those services, so that you don't have to be out of pocket, and you can get 6 or 10 sessions, I think it is, with a psychologist or a physio or anybody of your choosing, essentially, in what you need. And then they'll give you referrals and references so that you can easily kind of go into their system and get the help that you need. Anything outside of that isn't covered, but you can, I believe it's discounted, so it's not like it's going to cost you thousands. Like, if I went to see a psychologist for the stuff that I was talking to them about, I think it'd be something like $80 a visit or something like that. I see a physio next week because I'm trying different ways of managing my chronic pain. Mm-hmm. And I can request that it be put onto my work cover. Whether or not they approve that is a different matter. So it could become a free thing for me under my work cover claim, but that's separate to Medicare. But paying for the physio without any help is about $120 for a session. So, which I think in American dollars is about 80 or 90, maybe a bit less. So it's not a huge expense, but it adds up if you're not getting a lot of money in. But here we have a branch of the government called Centrelink, and if you're out of work, you actually get a stipend, like a fortnightly payment to help you keep on top of bills, to help you keep on top of food. One of the caveats of getting that, though, is that you have to look for work. If you're fit and healthy and able to, you have to go out and you have to look for a certain number of jobs every fortnight, or do training, which they can provide for free. There's lots of free services available to get skills that you need, to get better jobs, to get better opportunities. They provide a lot of that, but in return, you have to do the work. You have to go out and look for work, and if you get a job offer, usually you have to take it. They'll still give you those payments every fortnight while you're doing that. If you find a job but it's only part-time, they'll still pay you if you're working up to 15 hours a week. I think over that, then it starts to lessen how much you get, I think, or they take off your 15 hours or something like that, but you still get something from them every fortnight.
But yeah, we have a similar thing out here where unless you're disabled enough and get okayed by your primary care doctor to not have to attend that, then you still get somewhat of help, but it's not really that much help at all.
Yeah.
Yeah, no, not at all. Well, thank you for all your information, Lucinda. Thanks for coming on in, bringing in that Aussie awesomeness of information.
You're welcome. Thanks very much for having me.